known for years with his 5 heart attacks and most recently a heart transplant. Now, for the first time ever, the former vice president is opening up about his medical conditions and his 35-year battle with heart disease. His brand new book, which he co-wrote with his longtime cardiologist, Heart, An American Medical Odyssey, is in stores tomorrow. He joins us for his first cable interview. Mr. Vice President, how are you? Good to see you.
It's great to be back.
Appreciate I remember, and I'm trying to put chronologically the time in my mind with the book. I interviewed you at your house after you left office.
Right.
You were in pretty bad shape.
That was a rough patch, really. We went from, when I left in January of 2009, over the next 17 months, I went from, a serious heart patient, but at the end of that 17 months, I was in end-stage heart failure, near death.
Yeah. You were telling me you were on with Dr. Oz today?
Yes, yeah, Dr. Oz.
And what did he do? He had all different size.
He had, of course, he's a heart surgeon himself, and he knows a lot about the business, but he had a tray out in front of us on the table covered with a blue cloth, and then some gloves, latex gloves. Had us put on the gloves, and they pulled back the cover, and there were 3 hearts. I mean, real hearts, not models. Yeah. Real hearts. A little one that was normal size, and then a mid-sized one that had an LVAD, the kind of pump that I'd had on mine, and then a big one. And, of course, mine, by the end, it lasted me 70 years. I don't want to be critical of it, but it was more than twice normal size from all the scar tissue and so forth. But he'd have a very vivid display there, and he'd pick up the heart and hand it to me, and what do you think of that? And, I'd pass it off to John Reiner.
But yours, you took a picture of how big yours was at the end. How big?
It was close to 6 inches across. Normal size, it'd be about the size of 2 hands clasped together. Yeah. And this, after 5 heart attacks, sudden cardiac arrest, an implantable defibrillator, an LVAD, a pump attached to the left ventricle that kept it working the last 20 months until I could get a transplant. All of that work that had been done to it over the years, it's all gone now. The only thing that's left that shows that I was ever a heart patient is I've got a big scar down the middle of my chest where they went in 3 times and did open heart surgery. But I've got a brand new heart inside, and all the mechanical and electronic gear and so forth, it's all gone.
And you dedicated among the people in the book also to the person who donated that
donor.
Heart.
Yeah, absolutely. It wouldn't have happened without our donor and the donor's family. I don't know anything about the donor. I just know their heart was in much better shape than mine. After 1 year after the surgery, they go back in and do a complete catheterization of the arteries of the new heart. And those arteries are perfectly clean. There's no blockage of any kind. I probably haven't had a heart that clean since I was a teenager.
What is the difference in how you feel? Probably a basic question, but what is the difference?
It's, a couple of things that stand out. First of all, I reached the point where, you adjust after you've had heart disease that long. I was convinced that eventually I would die of heart disease, that we'd run out of time and out of treatment. The technology wouldn't keep ahead of my disease. Now, all of a sudden, when you get that new heart, your life opens up before you again. You don't know how long you're going to live. You're back to sort of normal expectations. You can't set a date out there when you're certain that you're going to hang it up. The other thing that goes with all of that is sort of the sense that I can get back and do anything I wanted to do. I reached the point towards the end on the old heart where I had trouble getting out of the chair. All I wanted to do was get out of bed in the morning, walk down the hall to my office, and sit back down in the chair. Now, I throw 50-pound bags of horse feed into the back end of my pickup truck and don't even think about it. I'm back doing all those things. The only thing I can't do now is ski, but that's got nothing to do with my heart. It's because I got bad
legs. Yeah. You said at one point you believed that you were approaching the end of your days.
I did.
And you said you weren't frightened, you were pain-free, at peace, and you felt you had led a remarkable life. Were you resolved to the thought that you thought you were going to die? Do you really believe that?
I did. I'd reached the point of what they call end-stage heart failure. The heart had gotten so weak after 5 heart attacks and sudden cardiac arrest and all the surgeries and so forth that there really were no options left, except that's when the LVAD, the pump, came on the scene. But I knew, given where I was at, that it was only a matter of days and eventually a matter of hours. When they did the surgery that put the pump in to sustain the heart, I was my kidney and liver were shutting down. The heart simply wasn't moving enough blood to feed my vital organs. They worked on me 9 hours on an emergency basis one night, used over 20 units of blood. It was a very, very difficult, the toughest procedure I had to go through, but part of that was I was so weak because I was so sick. My heart had worn out, in effect. And I came back out of that. I had pneumonia as I recovered. I was on a respirator for weeks, heavily sedated, and had to work my way through all of that to get back to the point where I was healthy enough to get a transplant.
When this first started, you had your first heart attack. You were, what, 37?
37.
37 years old. Was that like, I've heard somebody describe it like a car sitting on your chest. Was that what it felt like to you?
No. With me, it was very different. I had a tingling sensation in 2 fingers of my left hand. That was it. I had no chest pain. I didn't sweat or anything like that. I woke up in the middle of the night. I was on a campaign in Cheyenne, first run for Congress, staying with a friend. And the thing that triggered in my mind was that I had a first cousin who was a doctor himself who'd had a bad heart attack just a few weeks before. And that, I think, is what triggered the thought in my own mind that I needed to have it checked out. So I woke up the people we were staying with, and they drove Lynn and I to the hospital, and I walked into the emergency room, sat down on the table, and passed out. I was having a heart attack.
Wow.
But that's the only symptom I had, was just that tingling sensation in my left hand.
One thing, I guess the story, a big part of the story is that you ended up quitting smoking then, and you know, technology stayed one step ahead of you.
Exactly right.
Explain that part of this.
Well, if you think of all the things that have kept me going, cholesterol-lowering medicine, that came in 88. It cut
Statins.
Cholesterol levels. Statins was a miracle drug from my standpoint because that was one of my biggest problems, was a very high cholesterol level. The implantable defibrillator, that was like the set of paddles that they use to restart you when you go into sudden cardiac arrest. Well, in my case, my doctor, John Reiner, who co-wrote the book with me, had been wise enough to suggest back in 2001 that I should have an implantable defibrillator, something they could put under my skin, like a pacemaker, only it had the added feature of being able to measure your heart rate and shock it back into normal rhythm. 8 years later, that's exactly what happened, and that defibrillator saved my life.
And they had to reprogram.
Well, we had a problem because the latest version, which I had by then, was capable of being programmed remotely, which was a nice feature in terms of being able to manage it. But as vice president, the concern was that
Somebody'd kill you.
Somebody could kill me. If somebody on a rope line with the right kind of device could in fact interfere with that implantable defibrillator and cause it to go into sudden cardiac arrest. Some years later, in fact, on a
TV show.
Episode of Homeland, a TV show, bad guys did in fact kill the vice president by tampering with his implantable defibrillator.
One of the #1 killers of everybody. Great advice in this book, great counsel, and also it shows what medical innovation has done.
Well, what I hope it does too is convey the notion that there is hope.
Yeah.
And there are 80 million Americans out there who have some kind of heart disease. I look at an audience these days when I make a speech, and I can say with a fair degree of accuracy that every 4th person has or will have some kind of heart problem in their life. And part of what the story we wanted to tell here is to show the dramatic improvement in our capabilities of dealing with heart disease over the last 40 years.
It's amazing. You stayed really, literally one step ahead. Like you were the guinea pig the whole way, it seems like.
It was far enough along so that it all worked for me. And obviously, there was a lot of luck involved, prayers from a lot of people through the rough spots. My family was unbelievable. Lynn had to nurse me every day, had to change my dressing for 20 months while I was living on the pump.
That's tough.
So it was, an awful lot of people contributed to the effort, and for that I'll always be grateful, especially to the donor.
All right, talking about health care, we're going to talk about health care.